in the data that we presented, we initially showed the data with the MDS. There were a total of 39 patients who were treated with the standard dose azacitidine 75 per meter square day 1 through 7. The magrolimab has an interesting dosing regimen. We initially give it twice a week for the first 4 weeks, and we do an intra-patient dose escalation. And the reason for that dose escalation or dose ramp up is to try to mitigate on-target anemia. That is probably the only significant toxicity that we see. So CD47 is expressed heavily on the surface of red cells, especially older red blood cells. And when we do this kind of stepwise approach, we see that we're able to get clearance of the older red cells, and the body then compensates by producing younger RBCs. And then usually around day 12 to 14, once we get to the full dose, we no longer see the anemia. And that's been very consistent findings. So usually first 2 weeks we see anemia, we manage it, and then we don't see it further. So we had 39 patients presented on the MDS cohort, and then we had 29 on the acute myeloid leukemia. The good thing about the safety was that we had 0 early mortality, 60-day mortality, which in a high-risk MDS and acute myeloid leukemia population is quite positive. And we had only 1 patient who discontinued treatment that was on the AML cohort, and that was because of a infusion reaction. He had the significant tremors, actually got better within 24 hours, but the patient and physician decided they didn't want to continue. So all in all, I would say a very favorable safety profile, similar to what we've seen with azacitidine alone. We did not see any immune toxicities. We did not see significant neutropenia, thrombocytopenia. In fact, we see improvement of neutropenia and thrombocytopenia in about 6 to 8 weeks. So overall, quite safe.